I'm good.
I was just having a walk today, and I was admiring the nature and, you know, this river. And I think I'm really blessed to be here, Millie. But I also think that you and your community, you know, you are really blessed to be living in this region too.
Yo, both culture coming together to live in harmony and learning from each other.
Wow. You know what? I was just thinking of that. And I'm just thinking that it's why I'm organizing the Remote Health Experience 2013 in the Katherine region. And I'm really looking forward to have you and your group of Banajat Women's Group being part of it this year. It's very exciting.
That is good what you are doing. Both culture will bring together that knowledge.
I'm very happy, you know, that you approve, Millie, because we have been talking about that. And I have been very busy organizing all this experience for the students, but the results really seems to be coming together. All the students in Darwin are very excited to come to Katherine, and I think the Remote Health Experience 2013 is shaping very well. It's just a few days now, and I really hope that you and your Banajat Women's Group, you'll be part of it this year.
Yo, okay, Pascal, I am going to bless you with water. Power Urongo, Nadawal, Nogoro, Nagan Baskal, Nidanda, Dayapangana, Narawat na, Kainia Nangakudakan, Wulong Mungoikan. Yo, thank you, Pascal. You are now one of us, and we will work together in unity.
Thank you so much, Millie.
Yo.
I'm very honored to have become part of your community, and I am looking forward to us working together.
You're wonderful. Now we must go, Pascal, and walk in their shoes.
Yo, Millie, we go and honor the other people's stories.
Yo. Hello, my name is Milawanga Sandy. I originally come from Bestwick community, southeast of Katherine. I am involved with the Banajal Women Council group, and we are in partnership with the Flinders University as well as Fred Hollows. Today, Pascal and I did a story, the meeting of the two rivers that flows into one. Behind me here you see both rivers, both streams, flowing from different directions, coming together, joining into one. That is a significant presentation of what we did, because traditionally a lot of our people live alongside the river, so we become one when living in the river. So all these tribal groups from different part of the river, actually they're not alone, they're not by themselves, but they become one in unity with the rest of the tribal groups that live all along the river. The stream here signifies both cultures coming together, working together in unity and in that oneness, bringing both cultures together and learning from each other, and to work and to walk together as we saw where these two streams meet and then it runs out as one. So we are all walking in that big river as one in unity. And that is very special, and it holds that knowledge of sharing and giving, parting one knowledge, but acknowledging one another and having that respect for one another, not of the people, but of the land and of the traditional owners who live in those places. Yo.
Hi, I'm Dr. Pascale Detvillers. I am the academic lead and director of the Flinders Northern Territory Katherine site in Katherine. The Katherine Rural Clinical School is committed to develop the community and work with the community in developing opportunities to bring knowledge and teaching together. We do run a number of community engagement activities where we partner with groups like the Banajat Women's Group, with the Fred Hollows Foundation, with the Smith family, the Good Beginnings, and also more specific organizations like Clyde Fenton Primary School, Kinter Special School, and Step Out. These projects are created to build connection between the tertiary university, Flinders University, Charles Darwin University, Bachelor Institute with the community. We believe that our mission is building skills, capacity for the community, for the future of these communities and for the future of their children. The Remote Health Experience 2013 is another project we have been running in Katherine for 2 years, and that has been started at Bachelor in 2011 and then moved to Katherine when I took the directorship position to develop this program into a 3-day program. Today, Millie and I, walking by the river and doing the water blessing where the both river joins, was an exercise part of the Remote Health Experience 2013 that we hope to be able to repeat with the students, where each participant of this event this year in 2013 will be blessed by one of the Banajat Women's Group. This is to show to students that part of the learning is not only an academic, didactic learning in classrooms, but also the learning and the acquisition of knowledge can take place outside amongst the community members, sharing and learning together and building these bridges between the two communities. We hope that the event 2013 will be a great success and will be a milestone for the future events to come. Thank you.
I'm Sarah Strasser, Professor for Flinders University and Associate Dean in the NT. I am the head of the new Northern Territory Medical Programme. I'd like to tell you a bit about the importance of the remote health experience to training doctors in the NT Medical Programme. Flinders University has been in the Northern Territory for about 15 years, teaching medical students at the end of their training, and in 2009 we had the opportunity to work with the NT government, the federal government and Charles Darwin University in partnership to establish a new NT-based medical programme. This means that for the first time, Northern Territorians can train to do medicine without having to leave the Northern Territory. The NT-MP has from the first instance been extra focus on remote medicine and Indigenous health. In the longer term, we would hope that we can expand the 3 days to be more like a month, learning out of the classroom, away from the textbooks, actually in the community and truly engaged with the community to learn what they need to know to be remote practitioners.
Good afternoon, I'm Shelly Finn and I'm from Darwin. I'm a registered nurse and my background has been mostly in clinical nursing. I've spent 8 years in ICU nursing in central Victoria. So I've been in Katherine for the last couple of years and I've worked in the emergency department and more recently the surgical and medical ward. As well as being a nurse, I have also been getting into a little bit of the education side, particularly in regards to domestic violence and sexual assault, as a facilitator working for NAPCAN through their Love Bites program. The other main reason why I'm here is actually because of a YouTube clip that I actually saw last year from the 2012 Remote Health Experience. And that video clip for me, once I saw that video clip, it just concreted for me that, it's going to be an awesome weekend where, you can work with many different people from many different backgrounds of all different knowledge levels and experience. And I was forwarded to go and have a look at that website by Pascal, the professor here, who we are very blessed and fortunate to have our very own professor here in Katherine. Very excited about that, and I feel very blessed that I've met her and that I've had an opportunity to be part of this weekend. So yeah, I'm really glad that I was able to make it down this weekend, and I thank my husband for having the kids. But if you get an opportunity like this, don't pass it up. It's fantastic. Thanks for having me.
G'day, Dr. Bernie Wesley. I'm a GP from Darwin. It's my great privilege to be part of the training this weekend because educating the next generation of doctors, nurses, physios, Aboriginal health workers and all the rest of the team is very important. What keeps me passionate? Well, I enjoy giving a high level of service to my patients and I enjoy working as part of a multidisciplinary team and being actively involved in training to support a great working environment and great outcomes for the patient.
My name is Malcolm Johnston Leap. I'm the Medical Director of the ambulance here in the Northern Territory. At the Remote Health Experience this weekend, I'm running a simulation where we have a single vehicle rollover with multiple casualties. The idea of this is not so much on treating the patients, but how you would approach the scene, what you would do with the limited resources that you can, and how you can maximise the care of the patients given that it is a very remote situation. This involves a lot of thinking outside the box and cooperative teamwork, and I think the students are having a fantastic time working through this station.
Hello, my name's Malcolm Lauden. I'm an Aboriginal health worker. I've been an Aboriginal health worker for 13 years now, and I'm currently an Aboriginal health worker lecturer for Bachelor Institute. We have come down to Katherine for the Remote Health Experience. Part of the Remote Health Experience is actually a part of the course for the Certificate for Aboriginal Health Workers. It can be hard to understand for other health practitioners, so being down here this year for all of the students was good for them to reiterate their role, what they do in the community as health practitioners, students when they finally become registered, but it's also good for the nursing students, the medical students and the pharmaceutical students here to see what Aboriginal health workers do in the Northern Territory.
Hello, I'm Hugh Grantham. I come from Adelaide and my role down there is I'm the Professor of Paramedics. I've had a lovely weekend. I've seen lots of different people all be very enthusiastic. I've seen people from different specialities interacting, learning off each other. And that's the real beauty about this. We've learnt about how to do things differently, how to respect each other, how to respect working in the bush, and how to actually get that multidisciplinary team working. I like rural practice. It's different, it's better, it's challenging, and you need to be innovative and a communicator. All of these things we've been practicing this weekend. We decided we can actually do a lot of treatment just under a tree like this. You don't need high-tech equipment. This is what makes rural practice special. So the students today have had a really good basis, which I hope is going to stand them in their stead for all their future studies. So it's been a lot of fun, and I thoroughly recommend it to anybody else to come on another year.
Kia ora. My name's Ria Baker, and I've had the privilege of participating in the Rural Health Experience Day here at the Charles Darwin University campus. Along with my colleague, we have done the simulation learning education session, and in that session we focused on anaphylaxis and gave the students all the opportunities to learn about a very, very serious medical emergency. From my experience as a remote area nurse and an educator, these simulated environment learning sessions are valuable for students. It allows them the opportunity to learn in a safe environment and also to learn from one another. We had medical students, registered nursing students and Aboriginal health practitioners. Also, we had some pharmacy students. So the valuable information that they taught and learnt themselves also taught me. So I find it a great opportunity, and I'm really, really happy to be a part of these days.
My name's Sarah Charmans. I'm a senior lecturer in remote health with Flinders University and a remote GP from Nhulunbuy. This is my third time being involved with the remote health experience, and I think we've really consolidated our program this year. I think this year the storytelling has really helped with the bonding of the students. I definitely noticed that the students were better bonded this year than they have been in the past. I think they had a really, really good time. So I think that this experience is just going from strength to strength, and I can't wait to see what happens next year.
My country is the Tanamai. Near Katherine I was born. Witnessed on the Barclay and cradled by Capricorn. From the bosom of the Gulf I come, the Kimberley's kith and kin. MacDonald ranges to Wanham land, I'm the territory's blood and skin. My heart is the big sky country, home among rivers wild, schooled by floods and cyclones, for I am the territory's child.